Dr. Moss, if you would like to come on up, buddy, and just state who you are, and we'll get you sworn in.
Sure. I'm Dr. Alvin Moss. I'm a licensed physician in West Virginia. I practice in Morgantown. I am faculty at WVU School of Medicine. I've been faculty at WVU School of Medicine for 33 years, but I wish to make it clear that I am not here as a representative of WVU School of Medicine.
Thank you, buddy. I appreciate that. If you raise your right hand for me, do you solemnly swear or affirm that the testimony you shall give shall be the truth, the whole truth, and nothing but the truth, so help you God? Thank you, buddy. Proceed.
If I could, I'm sorry Senator Stallings is not here. He asked, are you aware of anything that vaccines might cause? And one of the discussions on Tuesday was about the flu vaccine. So if I could just talk to you for a minute about the flu vaccine. The flu vaccine happens to be the vaccine that causes the most injury in this country. Senator Romano, the Vaccine Injury Compensation Program, 40% of all vaccinations in this country are flu shots, but 60% of all the compensations are for the flu vaccine. So a disproportionate number of the vaccinations are, of the vaccine-related injuries are the flu shot. And just to talk about the flu shot, I think many of you may have been, it's been recommended to you that you get the flu shot, but I don't know if you're aware of the fact the CDC statistics are that every year they look at vaccine effectiveness. For this particular year, the vaccine effectiveness is 48%. So that means it's not highly effective. You heard testimony on Tuesday that we need about 95% vaccine effectiveness to reach herd immunity. So the flu vaccine falls far short of herd immunity, and it's not even all that effective. If you look at the scientific literature on the Cochrane database, they say the evidence to support giving the flu vaccine is moderate to weak. It is not strong evidence. They say the evidence to support giving the flu vaccine to people over the age of 65 is not there. It's inconclusive. So a lot of the things that we've been told as Americans with regard to vaccination are not really based on the science. And I just wanted to cover that. Senator Romano, you asked, are there any financial reasons for hospitals to push vaccines? The CDC developed a quality measure under the Quality Reporting Program, and they based it on the National Quality Forum Measure 0431, which requires hospitals to report their staff's flu shot rates. And it also looks at the flu shot rate for people who are admitted, whether they were admitted, whether they had flu shots or whether they had vaccinations prior to admission or whether they received vaccinations on admission. And I can tell you, as somebody who makes rounds in the hospital almost every day, that there's really a push to make sure that people in the hospital are vaccinated if they are behind, quote, the word behind, on their vaccinations. So the bottom line is that there's a reportable quality measure that the hospitals need to meet to be able to get the reimbursement. And the Medicare reimbursement rate per year for hospitals who meet this quality measure, among other quality measures in the bundle, is 3.75%. And I don't know about you, but probably many of you know that the profit margin for West Virginia hospitals in many years has been certainly less than 3%. It's only, and I'm not here speaking on behalf of the West Virginia Hospital Association now, but I'm telling you the profit margin over the years for many West Virginia hospitals has only been 1% to 2%. And so if you're looking at something that would reduce their reimbursement by 3.75%, that is not a cut that they could sustain. So they have a strong incentive to vaccinate their employees and to vaccinate their patients. Now, as it relates to this bill provides a religious exemption for employees who are working at a hospital. I work, as I've told you, and I'm not here to represent them, at WVU Hospital, and I am very thankful that WVU Hospital grants a religious exemption. I am told that Monongalia General Hospital, sort of across the street from us, does not. This bill would allow adults, employees, West Virginians, to get an exemption, a medical exemption or a religious exemption, so that they would not have to have a vaccine that they did not want. And I think all of you as adults would want to have the choice to exercise the right to whether or not you get a vaccine or not. And this bill would at least allow that type of choice, whether it's because of a medical exemption, because you've had a previous reaction that is somewhat worrisome, or because for religious reasons you would prefer not to get the flu shot. Senator Carnes, you asked, should the flu vaccine be required? And so I want to just sort of touch on that. If you have a vaccine that has an efficacy rate of less than 50%, if you have a vaccine that's responsible for the highest number of vaccine-related injuries of all the vaccines in the country, do you think it's really fair, and I'm asking that in a rhetorical way. I apologize, I'm a professor, okay? I'm asking it in a rhetorical way. Do you think it's fair that you be required to take a vaccine that has less than a 50-50 chance it's going to work, and that can cause significant injury? So that's sort of the thought behind my answering the question, no, the flu vaccine should not be required. There were lots of questions about what's in vaccines. There were questions of both Dr. Young and Dr. Costello about what's in vaccines. And I just sort of want to point out that I think many of you have heard of formaldehyde. Formaldehyde, as you may know, may cause cancer. It's in 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 vaccines. I could read the names to you, but I think that makes the case. Aluminum, I think many of you know that aluminum is a potent neurotoxin, and I know that Dr. Humphreys would like to talk to you about that, because aluminum is one of those things that's also in 11 vaccines, and it is very worrisome because of its neurotoxic effects. And then mercury is still in at least 3 vaccines, the multi-dose flu vaccine being the one that probably is the one that most people are exposed to on a regular basis. And so there are toxic ingredients. And just one other thing about the flu vaccine, and then I will be done, is that when we're talking about vaccine-related injury, and again, this gets back to Senator Romano, some of your concerns, and how do we know that people are really compensated, and is it really over $3 billion? The very worrisome toxic effects, vaccine adverse effects from the flu vaccine include Guillain-Barré syndrome, which you're familiar with. That's it's a paralyzing syndrome. It also causes chronic inflammatory demyelinating polyneuropathy. And I won't ask you to repeat that. It's CIDP, and it causes brachial neuritis. It causes a number of neurologic conditions, including seizures and paralysis. It causes a number of dermatologic conditions. Stevens-Johnson syndrome is a particularly bad condition where you can sort of weep your skin and you're exposed to infections. It causes another dermatologic sort of connective tissue disorder called dermatomyositis. So it causes a number of significant conditions, and then, of course, it also causes death. And I'm sorry, I just want to close with one other point about the vaccine injury, since it was specifically brought up on Tuesday. Dr. Costello said, and I really appreciate what she said. She said, really, even one death is too many. And she said that there have been 2 measles deaths. Actually, she talked about the measles death, I think, in 2015. There actually was another measles death in this country reported by the CDC in 2003. So there were 2 deaths, measles deaths, between 2003 and the present. What didn't come out in the testimony is during that same period of time, again, this is from the Vaccine Adverse Events Reporting System, there have been 127 measles vaccine-related deaths. So if we're worried about 1 death or 2 deaths from measles, what about 127 deaths from the vaccine as a complication? And I didn't mention, but obviously, you know, the flu vaccine has also been reported to cause deaths as well. So what about allowing people to exercise their religious exemption or a medical exemption so that they can avoid being forced to receive vaccines that could potentially be devastating or fatal? Only if you look at the Vaccine Adverse Events Reporting System, it's estimated, there have even been articles in the New England Journal of Medicine estimating that only 1 to 10% of injuries are reported. And the problem with the compensation program, and you're asking me about the compensation program, is people who are vaccine injured often don't even know that there's such a vaccine injury program exists, and people often find out after the statute of limitations or whatever it's called is over. So let me get back to the principle of informed consent that I think you as an attorney and me as a physician, and I teach medical ethics, and so I may be a little bit more sensitive or concerned about informed consent than, let's say, somebody who doesn't teach informed consent. So the problem is, and you saw this on Tuesday, with the whole thing, if your physicians don't know what is in the vaccine and what the vaccine-related injuries are, because Senator Stallings specifically asked both Dr. Young and Dr. Costello to comment on vaccine-related injuries. Dr. Stallings, I'll quote him verbatim, are you aware of anything that vaccines might cause? And if you recall, that was a follow-up line of questioning after he asked about autism, and there were not answers given. So I, as a physician, am very aware of not only the benefits of vaccines, but the harms of vaccines. And since I believe informed consent is important, I know about mercury in vaccines, aluminum in vaccines, polysorbate 80 in vaccines, formaldehyde in vaccines, pig and kidney cells in vaccines, okay? And so because I know that, that's part of the informed consent discussion. Now, ask me, in my own practice, I'm a nephrologist, I take care of kidney transplant patients. Kidney transplant patients are immunosuppressed. You can ask me, what percentage of my patients receive the flu shot? I'd say about 50%. I don't talk people out of it. I explain the risks and the benefits, and I believe it's their right to choose whether they want to receive a vaccine or not. I don't want physicians, I don't think it's right that physicians should be forcing patients to receive a vaccine that potentially could have severe injuries when the person is healthy. I mean, what is so sad is somebody who's healthy, and I know an employee at Jefferson Medical Center up in Pennsylvania who got Guillain-Barré as a result of a flu shot that the hospital required her to get when she was perfectly healthy, and then had a 9-month illness before she recovered. That was not her choice. Guess what? Jefferson Medical Center no longer requires flu shots.
Let me ask a couple other questions, and I know that's very important. Let me ask a question I asked everybody else. I'm sure you're ready for it. Are you aware of a reputable peer-reviewed study that links childhood autism with immunizations?
Okay, so you asked me that question. So the answer is yes, and I think I probably could lay my hands on at least 20, if not potentially over 100 articles that directly or indirectly look at this issue. As you know, it's a highly controversial issue. It's a debated issue. It could, if we really wanted to do justice to that issue, it would take us well over an hour, perhaps several days. But do you want me, I will ask you, do you want me to give you a short answer to that question?
Well, I heard you say articles. I just want to make sure we're talking apples and apples.
Okay.
I know the difference between an article and a peer-reviewed study. Has there been a statistically valid peer-reviewed study that links autism to childhood immunization?
And I believe the answer is yes.
How many are there?
And I, on the way down, my wife and I were talking about 28 articles that she had in one reference list.
Again, you go back to articles. Are you still saying the same thing I am?
I believe I am. I believe, every article gets a PMID number, PubMed.
Yeah, but I know that articles are also peer-reviewed. I'm talking about a statistically valid study where you could study 5 people and get a whole different answer if you studied 10 million people.
Okay, all right. So I think we need to be fair, we need to talk about the article that is quoted most widely to say there's no relationship between autism and vaccines. That's an article that was in the 2004 issue of the journal Pediatrics, highly respected journal. The first author was Frank DiStefano. He was from the CDC. And one of the authors, the author in charge of the statistics for that study was William Thompson. You may or may not recall, it did make national news a couple years ago. William Thompson is a senior scientist at the CDC. He came out and he said, we committed fraud with the publication of that article. It sounds like you're aware of that.
Oh, yeah, absolutely. And really, I was asking you, and I appreciate that one, and you're welcome to tell me about that one. I was really asking you in the other direction, though. Are you aware of a study that meets my parameters that links autism or immunizations to childhood autism?
And I think I'll send you a list of them if that's all right.
And again, you keep saying articles. I'm saying studies. Are they articles?
Yeah, yeah. Well, it's a study that's reported in an article. I'm sorry, physicians' studies and articles
we lawyers have different.
Are synonymous. Okay, right. Reported articles. reported studies, which becomes an article. But if I can just finish the point. So if, this was read into the congressional record by Congressman Bill Posey from Florida. He had pages of data, research showing that African-American boys were 3 times more likely to have autism if they had received an MMR vaccination. And it sounds like you may be aware of that study. So if that is true, and it was read into the congressional record, and William Thompson has admitted it's true, and we are now actually having a congressional committee investigating, subpoena him. So it could be within a month, you and I are both going to know there is a scientifically valid study in our recent literature that will show there's a link. There's an association. I'm not saying cause and effect. I'm saying an association.
Right.
Okay.
I'd sure like to see that, Doctor.
Sure.
I always enjoyed debating physicians.
Yes.
They know so much more than I do. But
Yes,
it's
yes.
been very
I enjoy
important.
debating lawyers, so thank you.
No,
Thank
you
you for
don't.
the
Nobody
opportunity.
enjoys debating a lawyer. But, hey, thank you, Doctor, and thank you for coming down and offering.
Sure, thank you.